It is now time for Ask the Expert. It seems more and more people are relying on herbal supplements to treat just common ailments.
But are those supplements safe to use? Dr. Jennifer Mackinnon from the Medical College of Wisconsin joining us this afternoon to talk a little about this. So for starters, a patient comes to you, asks, I want to take X or Y or Z supplement. What do you tell them?
Well, as a primary care provider, I like to look at the whole patient approach and first find out why they'd like to start that herbal supplement. And then I review the data. If there's good quality data saying it might have an effect, I say, well, maybe let's give it a try. Definitely if that data is lacking, then I usually advise a trial period of going on the medication so that we're all aware of what effects we're looking for. And if you don't get the effects, then go ahead and stop the medication.
Well, how can you tell if you're taking a quality supplement versus, say, some garbage that you just see on the shelves to try to get you to buy?
Right, that's a really good question. In 1994, the FDA was never really involved at that point. They called it the Dietary Herbal Supplement Health Education Act. And now when that passed, it really said that all supplements are dietary supplements. And as long as you don't claim to cure or prevent or treat a disease, you can put it on the shelves. Since then, especially in 2007 and 2008, the FDA is now getting more involved under what's called good manufacturing practices, where actually they're supposed to be held more accountable with proper labeling, where they actually list the manufacturer and a phone number and address. They're actually supposed to have all the ingredients labeled properly, which is new. And they're supposed to be manufactured more with standard practices.
And this is because, you're ingesting something in your body that can have a side effect. What can go wrong?
Right. So in some cases, there's additives that can actually affect different blood sugar, high or low, can actually affect hormonal effects, have estrogen or testosterone effects and not necessarily be known, and then also have effects on your heart. They can raise or lower blood pressure, cause fluid retention or rhythm problems.
So that's why it's really important to talk with your primary doctor about any supplements you're thinking about or are already taking.
Right, it is, because if we know, we can be a team and talk about it, especially if some of these side effects come up or interactions with medications you're already taking.
All right, Dr. Jennifer Mackinnon from the Medical College. Thanks for coming and talking with us today. Have a question for any of our experts? You can send an email, asktheexpert to tmj4.com. You can also leave a voicemail, the number right there on your screen.